Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I am here with one of my favorite people ever, Taofiki Gafar-Schaner, co-founder of Frontier Health and Resources, the 2020 ANA Innovation Award winner, and Taofiki is a nurse. So it
Hello.
is my pleasure to spend some time with you today. So thank you for that.
Thank you, Bonnie, for having me. Appreciate it.
Absolutely. And Taofiki, the world continues to change very, very quickly. And as nurses, people often look to us for guidance. What thoughts or insights can you share on how we can show up as our best selves and how do we make the world a better place?
I think the most important thing is to speak the truth, and speak the truth to ourselves and speak the truth to others, whether it be in our families or professions. As there's lots of things going on in the world today, and I think what's giving me hope is looking at things with fresh, new, and truthful eyes. For example, like we'll talk about making the world a better place starts with us recognizing what we need to do better. And so for myself, as we were talking about, specifically if you look at like something like the opioid crisis, I as a nurse, I give patients meds every day. We take care of their pain in an honest way, right? So the crisis happens, but we are part of that. Recognizing that I myself are part of the problem and I can be part of the solution gives me some hope. And I think that's a first way of seeing how we can change many things, whether it be making COVID treatments better or dealing with the racial injustice that have happened in this country. Is recognizing that we all play a part in it and we all can make it better, just as we're all active parts of this country. The other part is that I think it's important is when you build on that truth that you found in yourself, you become more aware. And so awareness, it creates a sense of community of going like, whoa, we recognize that there's a problem. Think of it like a patient that's crashing, right? So I know if I'm at the bedside and you're with me, Bonnie, I go, hey, I see something and I don't feel super comfortable with it. Bonnie, do you want to check this out with me? We both learn and gain by assessing something, right? We assess the situation and we look for a solution together. And I think that's what's super important today is that whatever's going on, whether it be COVID, whether it be the opioid crisis, whether it be racial injustice, is that we have to look at fresh eyes together, assess the data, and go, this is something that's going on, and we need to do something about it. I'm not going to turn around with you and I aren't going to look at a monitor and say, hey, patient's heart rate is 40. It's been that way for an hour. No big deal. Let's go back to doing something else. We're going to say we need to do something about it, whether it be calling the doctor or doing something ourselves, whether it be and using whatever's in our scope of practice, right? And I think that's what we have to look at it is take that framework and apply it to multiple aspects of our lives, whether it be inside or outside the hospital. I think we work as a team together, we assess things together, we gain truthfulness and awareness together. I think that just gives me hope. And there's been a lot of change since all of this. 2020 feels like it's been 3 years all wrapped into one, right? So I think in the last 6 months, it feels like 10 months or 2 years, we've all learned more information and gained more information. Now we need to do something with it and move our country forward, move our industry forward. COVID has changed a lot of things. And I think understanding that nurses are at the forefront of a lot of the changes that have happened. We have been the agent of change, right? We are at the bedside. We're also, there have been nurses who've met with the president. There have been nurses who work on their local perspective. There are public health nurses who've done a lot of things to influence how COVID is treated in their area. And so understanding that like we're the middleman for everybody. No matter which way it goes, there's a nurse in the middle of it. And so we have such power and we have such presence. And I think using that for good and understanding, like I mentioned, the things such as the health disparities that happen, the racial health disparities that happen in our country, nurses have a role in fixing that. We have a power to fix that. How there's a difference in sorry, Bonnie. There's a difference in motherhood maternity for Black women versus others. There's a huge difference in the data. And so nurses have an active role of going, okay, I have this patient that's more at risk to die within my care. It doesn't mean we're bad nurses that if that patient dies, but this patient's at risk, right? So understanding that when you admit that patient, that this is the person I'm taking care of. If I take care of somebody with immunodeficiencies versus somebody without one, I know I need to be more careful with this patient. It's not about treating somebody different because of their race, it's treating them because they're at risk for something. And so I would look at that same patient who's at higher risk of dying because she's a pregnant mother and she's African American in a hospital in America, versus as the same as I would look for somebody who I need to wear a mask for and make sure I wash my hands 20 times because they are somebody dealing with leukemia. And so we need to be careful of both cases, recognize that we have power, presence, and the work that we do has an ability to change the world. So that gives me such hope to see how nurses have been doing stuff. And I think we can use that good and power and speaking truth and awareness in other spaces.
I love that because while we sort of tongue in cheek say, well, while this is the year of the nurse and the midwife, this isn't quite what we intended. Yet, I think it is. I think this is our moment, and maybe we've trained and prepared for a very, very long time for these moments, right? This is when we have to look around the room and make sure that we have the right people and the right voices to make the decisions and provide the solutions to move everybody forward.
I
So
agree.
this is the time for us.
This is it. We would have wanted a nicer, more fluffy year, but we got the year that we've been preparing for.
Yeah, you bet. And we're going to step up and handle it. That was awesome. And so appreciate your time today. And I am Dr. Bonnie Clipper. And remember, at Wambi, moments move us.